Life after pancreatic surgery. Hello, this evidence-based content is prepared by Saboor Khan, fellowship-trained consultant surgeon, and if you or someone you care about has recently undergone major pancreatic surgery, you're in the right place. I know navigating recovery after pancreatic surgery can feel overwhelming. You're dealing with changes to your digestion, possibly managing diabetes for the first time, and wondering what your life will look like now. Pancreatic surgery includes several types of procedures. The most common is pancreatic duodenectomy. That's the Whipple procedure, which removes the head of the pancreas part of the small intestine, and sometimes part of the stomach. There's also distal pancreatectomy, which removes the body and tail of the pancreas, and in some cases total pancreatectomy, where the entire pancreas is removed. Now, why does this matter to you? Because your pancreas has two critical jobs: producing digestive enzymes to break down food, and producing insulin to control blood sugar. When part or all of it is removed, you're left managing both of these functions yourself. That's what makes recovery complex but manageable once you understand the roadmap. After pancreatic duodenectomy, diabetes resolved in 57% of patients who had new-onset diabetes before surgery, but it remained unchanged in those with long-standing diabetes. If you undergo total pancreatectomy, you will develop diabetes because you've lost all insulin-producing cells. This is permanent exocrine insufficiency and diabetes, which has a detrimental impact on long-term survival. You'll need to monitor your blood glucose levels regularly, typically before meals and at bedtime. If you're supporting someone through this, understand that managing diabetes after pancreatic surgery is different from typical type 1 or type 2 diabetes. The blood sugar swings can be more unpredictable because you've lost the entire regulatory system your pancreas provided. The research shows that diabetes associated with pancreatic cancer is incredibly common. Diabetes was more prevalent in pancreatic cancer cases at 47% compared to 7% in controls. What's crucial is that after surgery, some patients see improvement, but many require ongoing insulin therapy. The key concern is hypoglycemia, low blood sugar, which can happen when insulin dosing doesn't match food intake perfectly. The available evidence suggests that pancreatic enzyme insufficiency affects 64 to 100% of patients with pancreatic cancer, even those who haven't had surgery. After surgery, this number approaches 100%. What exactly is pancreatic exocrine insufficiency? It's when your pancreas can no longer produce enough digestive enzymes, particularly lipase, to break down fats. Fat malabsorption doesn't become evident until lipase secretion drops below 10% of normal levels. The typical characteristics you might expect are loose, greasy, foul-smelling, voluminous stools that are difficult to flush. But here's the catch. Patients tend to limit fat ingestion instinctively, so the main clinical manifestation is actually malnutrition and weight loss rather than obvious diarrhea. This is where pancreatic enzyme replacement therapy becomes critical. You'll take enzyme supplements with every meal, not after, but during. The standard dosing is 30,000 international units of pancreatic lipase during each full meal, which equals approximately 90,000 USP units. For snacks, you take half that dose. Patients should be instructed to take enzyme supplementation at the start, at the middle, and near the end of a meal. This timing matters because you want the enzymes mixing with your food as you eat. Several commercial preparations are microencapsulated and designed to be acid-resistant, protecting them from stomach acid before releasing in your small intestine. If you're supporting someone through this recovery, patient compliance is a key factor in the success of therapy. Missing doses leads directly to malabsorption, weight loss, and nutritional deficiencies. Classically, the approach to pancreatic enzyme insufficiency was to restrict fat intake to less than 20 grams per day to reduce diarrhea. However, this approach restricts intake of fat-soluble vitamins, which are already malabsorbed in patients with enzyme insufficiency. The data now shows that the half-life of enzyme activity within the small bowel is actually enhanced by the presence of fat. In a dog model, both fat absorption and digestion were higher when enzyme supplements were taken with a high fat, as compared with a low-fat diet. For all of these reasons, fat restriction should no longer be considered the rule in managing pancreatic enzyme insufficiency. Frequent meals of low volume are generally recommended. Think 5 to 6 small meals throughout the day, rather than 3 large ones. Avoid foods that are difficult to digest. Legumes are a prime example. Focus on easily digestible proteins like fish, chicken, and eggs. Include healthy fats from sources like olive oil, avocado, and fatty fish. If your enzyme replacement isn't working adequately, several factors might be at play. Underdosing of enzymes is common. Acidic intestinal pH can be a problem. The enteric-coated tablets require a pH above 5 for the pancreatic enzymes to be released. In cases of insufficient response to enzyme supplementation, your doctor should review dosing and compliance, and consider adding a proton pump inhibitor to reduce gastric acid secretion. First, establish a meal routine with pancreatic enzyme replacement. Set reminders on your phone to take enzymes at the start, middle, and end of every meal. For full meals, take the equivalent of 90,000 USP units of lipase. For snacks, take half that amount. Second, shift to 5 or 6 small meals daily, instead of 3 large ones. Smaller volumes are easier for your compromised digestive system to handle. Each meal should include easily digestible protein. Think a palm-sized portion of grilled fish or chicken, about 3 to 4 ounces. Third, if you have diabetes, begin systematic blood glucose monitoring. Check before each meal and at bedtime. Keep a log for the first month so your diabetes specialist can see patterns and adjust your insulin regimen accordingly. Recovery typically takes several weeks to months to stabilize blood sugar control. Fourth, maintain a food and symptom diary. Note what you eat when you take enzymes, and any digestive symptoms like bloating, diarrhea, or abdominal discomfort. This information is gold when troubleshooting with your healthcare team. First, if you're experiencing ongoing diarrhea or fatty stools despite taking enzymes, ask about adjusting your enzyme dose or adding a proton pump inhibitor like omeprazole. The question to ask is, could acid in my stomach be preventing my enzymes from working properly? For diabetes management, ask about seeing an endocrinologist who specializes in post-surgical diabetes. Your specific question: my blood sugars have been difficult to control. Would a specialist with experience in pancreatic diabetes be helpful? Discuss monitoring for fat-soluble vitamin deficiencies. Ask, should I have my levels of vitamins A, D, E, and K checked, and do I need supplementation? Fourth, if you're losing weight despite eating and taking enzymes, this is urgent. Ask, I'm losing weight despite taking my enzymes. Could we review my dosing schedule and consider additional nutritional support? You need urgent medical attention if you experience severe hypoglycemia symptoms, confusion, shakiness, sweating, rapid heartbeat, especially if you can't correct it with fast-acting glucose. This typically requires immediate care within hours. Contact your surgeon or gastroenterologist within 24 to 48 hours if you develop severe abdominal pain, persistent vomiting, or signs of infection like fever above 38 degrees Celsius or 100.4 degrees Fahrenheit. See a nutritionist or dietitian if you've lost more than 10% of your body weight in the first 3 months post-surgery, or if you're struggling to maintain adequate caloric intake despite enzyme replacement. Pancreatic surgery fundamentally changes how your body manages blood sugar and digests food, but with proper enzyme replacement, dietary adjustments, and diabetes management, most patients adapt successfully. Your next step: schedule appointments with both an endocrinologist and a dietitian experienced in post-pancreatic surgery care within the next 2 weeks. This information is for education. Always discuss your individual situation with your healthcare provider. I've outlined several reputable resources here, which you may find valuable for further information on this topic. These include guidelines from the American Society of Clinical Oncology, the National Comprehensive Cancer Network, and the British Society of Gastroenterology on managing pancreatic exocrine insufficiency. Thank you for watching.